Okay, na-master naman din yung brachial plexus, di ba? Bawas exam. Okay, so this area here, these are now your spinal nerve roots here. So yeah, so this would be your C5, C6, C7, C8, T1, spinal nerve roots. Now, okay, your C5 and C6 now fuse together to form your upper or superior trunk. Your C7 will just continue forming your middle trunk. Then your C8 of T1 will now fuse together to form your lower or inferior trunk. Here, so mana siya na upper, middle, lower, or superior, middle, inferior, because of their position here. Okay. After the trunk, what will follow? Vertical drinks, division. So division now, you have two division, anterior, posterior. Di kayo maklaro ang division. Sige na lang. Mas expect ka ng division in this area. After division, what will follow is the coffee or the cord. Okay, so cord, you have three cords. Oh. Robert Taylor, drink coffee, black.
Robert Taylor,
What do you mean, oh, di siya black, brown. Pwede yung said brown. Yan. Ano may brown coffee rin, di ba? Okay, you have your lateral cord. You have this cord. You have three. So one here on the lateral side, so you have this lateral cord. Siya. One on the medial side, so you have this medial cord. Then one a little bit behind these two cords, kani siya, you have the posterior cord. Okay. So your lateral cord would have one branch, kani siya, branch there, towards your BBC muscle. So you have your musculocutaneous nerve. Your lateral cord and your medial cord now fuse together to form this nerve. Further go down, we call this as your median nerve. So one branch here, makara median nerve. This one here, kani siyang gamay, ano siya niya, kana yellow, kani yellow. So you have your anterior interosseous nerve. Yeah, here these are the cutaneous branch of the median nerve. Okay, next, your medial cord would now branch here. So medial cord may siya, so nasa isa ka branch here. So this nerve there goes behind, so that would now be your ulnar nerve. So at this area here, since palmar side man siya, so you have the palmar cutaneous branch of the ulnar nerve. Okay, next, this nerve, pwede naman para radial nerve here. Dili na siya nigawas. So this would now be your radial nerve. So one there that goes towards superficially, so you have your superficial nerve or superficial branch of radial nerve. Yung kanya siya mo pierce towards the muscle, so you have your deep branch of the radial nerve. Yun na. Okay, next, artery. So here you have your subclavian artery. Then next, after your lateral border of the first rib, pecta coronary yung first rib, so lateral border. So this level here, this now forms your axillary artery. Axillary na ni siya. Estimate na ako mo end ang lower border sa first major here. So therefore this artery will now be your brachial artery. So your brachial artery will now bifurcate into two. One at the lateral side, so you have the radial artery. One at the medial side, you have the ulnar artery. Okay, branches. Branches here. One branch here, together with your anterior interosseous nerve. So this one, you have anterior interosseous artery. Anterior interosseous artery. This one here. So you have now superficial palmar branch of the ulnar. There is superficial palmar branch of the radial. Now it forms this arc, we call it your superficial arterial palmar arc. And from there you have your palmar digital artery. Okay? Then vein, this one, putol, you have your axillary vein. Yeah, on the other side, this one, you have the superficial vein. So, BMW. BM means basilic median. So, basilic vein in the medial side, and the lateral side, you have your cephalic vein. Between the two, you have this what you call your median cubital vein. Then, these are more macutaneous nerve. Okay.